Hey guys, in today's video, we're going to go through a case that really makes you stop and think, especially when you're trying to figure out soft tissue lesions in the oral cavity. So let's jump right into it. We've got a 43-year-old male who shows up saying there's this lump inside his cheek. He's had it for several months, and he says it's not painful, not bleeding, and it just kind of sits there. It's been slowly growing, but not aggressively. He also, casually mentions that he bites his cheek sometimes, not constantly, but enough that it happens here and there. No systemic problems, and he doesn't smoke or anything like that. Now, when you look inside the mouth, you find this single round firm bump on the buccal mucosa. It's around 1.8 centimeters, has a smooth surface, and the color of the overlying mucosa is totally normal, not ulcerated, not red, nothing like that. The lesion's mobile, non-tender, and there are no swollen lymph nodes or anything suspicious like that. All right, let's look at the options. So first, we've got mucoepidermoid carcinoma. Now, this is like the most common malignant salivary gland tumor, right? But um, typically, these are more common in the palate than in the buccal mucosa. And more importantly, they tend to show signs that make you think of malignancy, like ulceration, fixed nature, rapid growth, or sometimes pain or paresthesia. And this case doesn't have any of that. The lesion is mobile, painless, slow growing, which is not how carcinomas usually behave. So yeah, we can pretty confidently rule this one out. Next is lipoma. So lipomas are benign tumors of fat tissue. They're soft, often yellowish, and they kind of feel compressible when you palpate them. But here the lesion was described as firm, and the mucosal color is normal, not yellowish. Also, lipomas aren't usually related to trauma or biting, so while it might sound similar at first, it doesn't quite fit the clinical picture here. Then we have neurofibroma. Now, neurofibromas can definitely show up in the oral cavity, and they are firm, painless, and submucosal. But they're often part of a systemic condition, neurofibromatosis, and in isolated cases, they tend to be a bit more uncommon. They also often feel a little more rubbery than fibromas and don't really have a strong link to trauma. So, possible? Yeah. Likely? Not really. And we've also got minor salivary gland adenoma. So this would include things like pleomorphic adenoma. These usually show up on the palate where most minor salivary glands are concentrated. Buccal mucosa is a possible location, but not common. Plus, the lesion here is super classic for a reactive lesion. No mixed consistency, no lobulated surface, no slow progressive nodularity. It just doesn't have the salivary gland tumor vibe. And that leaves us with buccal fibroma. And yeah, this one checks all the boxes. Like it's a super common benign lesion that results from chronic irritation or trauma. And in this case, the patient literally admitted to habitually biting that cheek area. It's usually firm, painless, mobile, and covered with normal mucosa, exactly like what we saw here. And it tends to grow slowly over time. So everything in this case kind of lines up with a fibroma. That's our best fit here. All right. So yeah, the most likely diagnosis here is a buccal fibroma. Hope that helped you guys think through the options and kind of connect the dots between history and clinical signs. If it made you pause and think, then that's the whole point. See you in the next one.